everyone. Thanks very much for inviting me here today. And I was just reflecting on some of our other speakers and thinking about them describing different types of healthcare. And interestingly enough, primary care, the word primary care I didn't think, unless I might have missed it, actually came up once. And I think that's probably an indication of how primary care feel when it comes to COVID-19 and the guidance. So I just want to talk through a few of some of the findings and some of the learnings that we've had from primary care. So I'll be going through pre-pandemic, and when I say primary care, I'm talking today mainly about GP surgeries, but of course primary care is much more than GP surgeries, as everyone knows. It also includes pharmacy, ophthalmology, and dentistry as well, but today I'll be focusing on GP surgeries. Really what the picture is nationally and locally in Surrey, some early pandemic learning that we had, feedback that we had from our 104 practices in Surrey, what we actually did as a result of that feedback, and there'll also be, hopefully, the videos work, a couple of presentations and reflections from two of our practice nurses in Surrey. So what was the picture in Surrey pre-pandemic in primary care in our GP practices? Well, like I said, we've got 104 GP practices. We're very lucky. The majority were actually rated good by CQC. And we've got an established primary care contracting team as part of the clinical commissioning group, where they've got good knowledge, good relationships of our GPs. That was really our key strength. However, during that time period, as you can see there, January 2020 to 21, we had 18 outbreaks in our GP practices. Most of those outbreaks were staff-to-staff transfer. I don't know if that surprises anyone, but the majority, we had a lot of staff initially in the pandemic not wearing masks at all. That's non-clinical staff not wearing masks. Even some of the clinical staff not wearing masks in the early parts of the pandemic. Doctors wearing cloth masks in early parts of the pandemic. Quite shocking, really. And again, there was always a big surprise in primary care when they had an outbreak. They really couldn't understand why on earth they'd had an outbreak. And bearing in mind, a lot of them are in very small rooms, working very, very closely together. And you'll see a lot of use of plastic screens in primary care. Quite often pull-up ones, I'm not entirely sure how effective they are. Going to our first speaker's point about evidence-based. There's not a lot of it in primary care when it comes to infection prevention control, unfortunately. So, unfortunately, our other big issue, as far as the CCG were concerned, there was a lack of IPC specialist support. That role hadn't been filled. And we also had, amongst our practices, as a result, a very, very variable baseline of infection prevention knowledge and confidence in application. So we really were up against it in the early pandemic. Another issue, I think, within primary care is actually there's a lack of recognition in primary care. Like I said when I first started, who mentioned primary care when they were describing healthcare sectors? And really that's been one of our biggest key problems in terms of lack of confidence, lack of evidence. And again, I know a lot of NHS nurses struggle to actually access infection control training, but if you talk to your average practice nurse, do they get time to attend infection control workshops, seminars, long courses? Does anyone pay for them? The answer is simply no, it doesn't happen. So again, remember, a lot of practice nurses in primary care, as I say, employed by GPs, and GPs do run those surgeries as mini businesses. And I think that's an interesting thought. Don't know what others think about that one. So, as you can see from those 18 outbreaks, it quickly became apparent that primary care was very ill-equipped, certainly in Surrey, to manage the pandemic. We did have some successes with remote telemedicine. We managed to get that up and running very quickly in Surrey. But like I say, the IPC guidance we found was very NHS acute trust centric. Some of the NHS trust people might say it wasn't even that, but we found it so in primary care. Lack of PPE in primary care, I would say very recently primary care has got access to FFP3 masks via the portal. And when I say very recently, probably between 2 and 3 months ago. Up until then, primary care had to buy FFP3 masks. Okay? So when you start to see how far behind primary care are when it comes to things, a simple thing like an FFP3 mask, you can see where we're coming from. And you'll hear from one of our practice nurses that fit testing is not readily available either still. Again, I think you've got to ask yourself what the picture is for future pandemics, if primary care is that behind currently in terms of PPE. Again, as we've said there, they didn't know how to access help, certainly in Surrey, where I'm talking from. There was a lack of knowledge and confidence. And one of our big issues was cleaning standards were hugely varied in GP practices. We've got some of our GP practices in nice modern surgeries with cleaning contracts, look great. But we've also got, because we've got rural locations, Mrs. Mop from the next door who will push the mop round in some of our GP surgeries that are in houses. So again, huge contrast and a lot of work to do when it comes to implementing cleaning standards, definitely. So we're hearing from our primary care colleagues that there was a lot of uncertainty and a lot of concern within primary care in Surrey. So we brought together our primary care colleagues. So every GP surgery's got what's called an infection prevention control lead. Quite often it's someone who was walking too slowly. They stuck the badge on somebody as they're walking past. Sadly, these people quite often don't have access to any education and training. It just isn't out there nationally for them, and it certainly isn't free. So we brought them together, and these were a collection of practice nurses, practice managers, and a couple of GPs, and we said, right, what's been working well for you in the pandemic? Let's not always focus on the negatives. What's been working well? And hopefully you can see that. Sorry, I don't know if it sort of comes up very well on the screen. But you can see there, at that time in July, that PPE was good. So that's a positive. Having scrubs made for us, which was nice. And I know that happened nationally as well. But teamwork was absolutely crucial. And you can see that it really came out very positively there. Wonderful teamwork. Decluttering. Well, I would argue there's a lot of GP surgeries need to do more on the decluttering currently from the ones I've seen. So we also asked them what's not worked so well for them. And this is July 2021. And ventilation is absolutely key. Now, I've only got 20 minutes, so I'm not going to go on. But if you look at, do you think the average practice nurse, GP, or even practice manager can look at HTM 2010 building guidance and apply that easily and quickly? They can't. So what do they do with ventilation? Well, you could say, open the window then. They can't open the window in many cases because quite often their surgeries are in the street and they're having confidential conversations. So it's really, really difficult ventilation in primary care, and that's something, again, we've got no evidence base to actually say to all of our GP practices. Again, some in some very modern buildings, some in some houses and bungalows. There's one in an elderly bungalow that I go and visit. Again, where's the advice, support and guidance when you're actually in NHS estates that really aren't fit for purpose? So I think for me, we do need to focus much more on ventilation guidance for primary care. It isn't there and it isn't out there easily for them to understand, I would argue. You can see there stress levels, spots due to face mask, rash on face. These will all seem quite familiar to a lot of people. GPs not seeing patients, I think that's quite controversial. Not having enough space, and that's certainly true in many of these primary care settings. Not having enough time to clean, I think is quite an interesting one as well. So a lot of practice nurses under huge pressure to get reopening, to get back onto it, to get through lots and lots of patients and not having time to clean in between those patients. Staff too busy to clean again. So what do we do when we have this workshop? Because obviously we needed to make a response to this. So we obviously ensured right from the early start of the pandemic, that was one thing we could do quickly and easily, was make sure there was an IPC specialist support for primary care and the independent sector in Surrey as well. So that was crucial and a really good, as I say, something we rectified very quickly. We also had a generic email which we promoted very heavily through all of our comms, that anyone, healthcare assistant, anyone at all, practice manager, doctor, didn't matter, could ask us an infection control question and they would receive a written response. And they really liked the written response because they could actually share that with others in the practices. So that was and it still is used well, and it's very, very popular. Quite often it's trying to interpret guidance. I also set up a primary care IPC forum, so that was an opportunity virtually for practice nurses, practice managers, GPs to come together quarterly and actually talk about the guidance, talk about best practice, and it had a meeting element and also an education component because, as I said before, the education was really lacking. And this has been hugely popular and is attended by over half of our practices every time. I did have one very brave person who came on one of our first forums who asked me what IPC meant. And that's the starting point. That's where we were starting from in some practices. We created an outbreak support pack, which again, practices weren't used to. They didn't know what to do. All of a sudden, these staff were going off with COVID. There was a panic. What should they do? What's the process? So they found that useful. We also put in some additional cleaning support. As I say, Mrs. Mott wasn't really cutting it in some of our practices. And again, and certainly my colleagues have been campaigning, as you won't be surprised, on regional and national forums for a greater primary care focus. So again, as part of me being part of the IPC Shared Professional Decision-Making Council, and these are councils run by Ruth May, our chief nurse, I've been actually fortunate enough to create a small working party looking at the cleaning standards. And if any of you have looked at the cleaning standards appendices, very NHS trust-centric. So we've actually rewritten those to make them more primary care friendly. And the national team, I don't know if Emma's here today, she's speaking tomorrow, but they've approved the appendices and we're waiting for them to upload them on the website. There's a long queue, seemingly. But Emma Brooks has been very helpful with that. So again, they're now available and will be nationally available soon. And again, there's a much better chance primary care will actually do something with the cleaning standards if it's primary care friendly. So again, we were visiting practices to support with other IPC issues. There was a big eye gas outbreak in one of the wound clinics. And we also created a web page on their intranet to kind of pull together all of the information to help them. I just want to show you a couple of videos, hopefully, if it works. And these are a couple of our practice nurses reflecting on the pandemic.
Hi, I'm Henny. I'm the lead practice nurse in a small rural surgery of just over 5,000 patients. The pandemic has made us feel more isolated than usual, but the CCG Infection Control Team set up a quarterly online forum for the IPC leads, and this has helped us to share concerns and disseminate information. We're fortunate enough here to have a new purpose-built and flexible building, which has enabled us to facilitate the safe use of the surgery by both patients and staff. With the use of added perspex screening in reception and the administration office, along with the opportunity to repurpose a treatment room next to the back door as a hot room and to restrict patient access to just a single corridor, we have kept both patients and staff safe through the height of the pandemic. We didn't suffer an outbreak, and when a patient seen in the hot room turned out to be COVID positive, we were able quickly and effectively to isolate the room and surrounding area to allow deep cleaning without having to close the whole surgery. We managed to keep the dispensary open throughout by clear and effective signage about the rules for wearing masks and requirement for social distancing, applying to all coming to collect medication. Unfortunately, the primary care network has not facilitated the fitting of FFP3 masks, so vulnerable staff have had to take their own measures to ensure their safety. We have, however, been fortunate in being able to obtain all the PPE we have needed throughout the pandemic. We are lucky to have mostly compliant patients in our community, which has helped us to continue seeing patients face-to-face as necessary and when needed. But critical media coverage has sadly encouraged the public to think that most GP surgeries were not seeing patients, and this has led to delays in some patients seeking advice from their doctors and therefore compromising diagnosis and treatment for potentially life-threatening conditions.
And Lauren.
My name is Lauren. I'm a practice nurse in Surrey and I am the Infection Prevention and Control Lead within the practice. The pandemic has been a challenging time where we had to learn and adapt our skills in care and safety for our patients, ourselves, and our families. Infection prevention and control was a key factor in this, as PPE equipment, training and knowledge was required at a fast pace but not always accessible with the changing times. The importance of teamwork for me was demonstrated through support, professionalism and resilience, which kept us motivated and dedicated to ensure patients' quality of care remained person-centred and of a high standard.
So I hope you found that quite interesting, but I thought it was quite nice to actually get some practitioners, people working in primary care, our practice nurses, to give them a voice to this conference as well. Those are sort of people that don't, again, the chance for them to actually even come to this conference is probably nil. So I think it's quite important that they can at least come and talk to you. So I just want to sum up again with my key learning, really, that I do feel there's a lack of recognition of primary care and national IPC guidance, and this has certainly hindered our GP practices. It's certainly hindered them going back to normal. There is definitely a big inequality between NHS nurses accessing education, recognising a lot of them don't access it as well, but in terms of those that are contracted to provide NHS services, it's nigh on impossible for them to access long courses, for example, and certainly not to be paid for them. And this is just my final reflection, really. Most of the population will access most of their healthcare in primary care settings. Should there be more parity of support for primary care, and what should that model look like? And again, I would be promoting an empowerment model for that.